Welcome to MCQs for All. Most trusted MCQs, 5-star rating, most economical in market, plenty of success stories and quality updated MCQs by experts. MedicalMCQ4All is a very high-yield material which is prepared to get best results from various exams such as DHA, MOH, HAAD, DHCC, OMSB, SMLE, QCHP, NHRA, KMLE for GP doctors and family physicians. Also helpful for other exams like PLAB, USMLE, AMC and NEET PG aspirants. It includes practical scenarios in daily medical practice, past papers and mock tests very similar to that in real exam. Our services. Meet our experts. Here is our team. Contact information. Let's begin. 1. Low TSH, low T3, low T4, low TRH, thyroid releasing hormone. What is the most likely condition? Options are A. Primary hypothyroidism, B. Secondary hypothyroidism, C. Tertiary hypothyroidism, D. Quaternary hypothyroidism. The correct answer is option C, tertiary hypothyroidism. This case is tertiary hypothyroidism, primary hypothyroidism, TSH high T3, T4 low, secondary hypothyroidism, low T3, T4 and TSH, tertiary hypothyroidism, low T3, T4, TSH and TRH. 2. A middle-aged person reported to psychiatric OPD with the complaints of the fear of leaving home, fear of traveling alone and fears of being in a crowd. He develops marked anxiety with palpitations and swelling if he is in these situations. He often avoids public transport to go to his place of work. The most likely diagnosis is? Options are A. Generalized anxiety disorder, B. Schizophrenia, C. Personality disorder, D. Agoraphobia. Correct answer is agoraphobia. Agoraphobia is a type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless or embarrassed. With agoraphobia, you fear an actual or anticipated situation, such as using public transportation, being in open or enclosed spaces, standing in line or being in a crowd. The anxiety is caused by fear that there's no easy way to escape or seek help if intense anxiety develops. Most people who have agoraphobia develop it after having one or more panic attacks, causing them to fear another attack and avoid the place where it occurred. People with agoraphobia often have a hard time feeling safe in any public place, especially where crowds gather. You may feel that you need a companion, such as a relative or friend, to go with you to public places. The fears can be so overwhelming that you may feel unable to leave your home. 3. A 35-year young man comes to the clinic for evaluation of intermittent episodes of shortness of breath. Currently, he is not short of breath. What is the best test to determine a diagnosis of reactive airway disease? Options are A. Chest X-ray, B. Diffusion capacity of carbon monoxide, DLCO, C. High-resolution CT scan, D. Methacholine stimulation testing, E. Pre- and post-bronchodilation pulmonary function testing, PFT. Correct answer is methacholine stimulation testing. Methacholine stimulation testing looks for a decrease in FEV1 in response to synthetic acetylcholine. Methacholine will decrease FEV1 if the patient has asthma. The DLCO is a good test of interstitial lung disease, in which it is decreased. Asthmatic patients may have an increased DLCO from hyperventilation. High-resolution CT scanning is a test for interstitial lung disease and for bronchiectasis. Pre- and post-bronchodilation PFTs are an appropriate assessment if the patient is currently short of breath to see if there is improvement, but they are of no value in an asymptomatic patient. Chest X-ray is not specific enough to be the most accurate test. 4. You are responding on an ambulance to a wedding, where the elderly father of the bride has collapsed while dancing. Bystanders say he was complaining of chest pain earlier but didn't want to mess up the celebration by going to the hospital. He was dancing when he suddenly lost consciousness and fell to the ground. Bystanders have started CPR, cardiopulmonary resuscitation. You arrived and placed the patient on the monitor. It shows sinus bradycardia but the patient has no palpable pulse. CPR continues with high-quality compressions and ventilation. You have established for access. The only drug appropriate in this scenario would be. Options are A. Atropine, B. Lidocaine, C. Epinephrine, D. Amlodipine. Correct answer is epinephrine. Epinephrine is the primary drug used in the pulseless arrest algorithm. It is used for its potent vasoconstrictive effects and also for its ability to increase cardiac output. Epinephrine is considered a vasopressin. Indications for ACLS. Vasoconstriction effects. Epinephrine binds directly to alpha-1 adrenergic receptors of the blood vessels, arteries and veins, causing direct vasoconstriction, thus, improving perfusion pressure to the brain and heart. Cardiac output. Epinephrine also binds to beta-1 adrenergic receptors of the heart. This indirectly improves cardiac output by increasing heart rate, increasing heart muscle contractility, increasing conductivity through the AV node. Epinephrine is used in the pulseless arrest algorithm as a direct forward push, and also, in the bradycardia algorithm as an infusion. Five. Which of the following is the earliest finding of osteomyelitis on an X-ray? Options are A. Periosteal elevation, B. Involucrum, C. Sequestrum, D. Punched out lesions. Correct answer is periosteal elevation. The earliest finding of osteomyelitis on an X-ray is elevation of the periosteum. Involucrum and sequestrum are terms applied to the formation of abnormal new bone in the periosteum and chunks of bone chipped off from the infection. Punched out lesions are seen in myeloma, not osteomyelitis. Osteomyelitis does not have an association with fracture. 6. A young man met with head injury with dripping of clear fluids from ear and nose. Presence of what confirms the fluid to be CSF? Options are A. Glucose, B. Lactose, C. Proteins, D. Cholesterol, E. Amino acids. Correct answer is proteins. Protein beta-2 transferring is a protein found nearly exclusively in CSF, and can be identified in nasal drainage. Beta-2 transferrin assay is very specific to CSF. However, the test is expensive, and results may take several days to weeks to receive. Most leak will have closed before the results are available, making this a poor test. 7. A 45-year woman ingested 10 grams of acetaminophen before 6 hours now came to you in emergency room. What is the best to give? Options are A. Activated charcoal, B. N-acetylcysteine, NAC, C. Gastric rouge, D. Just monitors and waits for level of acetaminophen. Correct answer is N-acetylcysteine, NAC. Toxic level more than 8-10 grams ingestion. Alcoholism decreases the amount of acetaminophen needed to cause toxicity. 4 common questions asked for acetaminophen toxicity. Answer 1. If clearly toxic amount of acetaminophen has been ingested, means more than 8 to 10 grams, the answer is N-acetylcysteine, NAC. 2. If overdose was more than 24 hours ago, there is no therapy, supportive care only. 3. If amount of drug ingested is unclear, get a drug level. 4. Charcoal does not make NAC ineffective. Charcoal is not contraindicated with NAC. 8. Which of the following will become abnormal first after acquiring acute hepatitis B infection? Options are A. Bilirubin, B. Surface antigen, C. E antigen, D. Corim antibody, E. ALT, F. Anti-hepatitis B antibody. The correct answer is surface antigen. Surface antigen is measure of acute viral particles. Bilirubin and antibody production are measure of body's response to infection. 9. A man comes in with neurosyphilis. He has a history of life-threatening anaphylaxis to penicillin. He has a history of essential tremor and is on propranolol. He has asthma and is on an inhaled beta agonist and inhaled steroids. Which of the following is most appropriate? The options are A. Use ceftriaxone instead of penicillin, B. Stop propranolol prior to desensitizing him, C. Bolus with oral steroids prior to penicillin use, D. Add long-acting beta agonists to treatment. The correct answer is stop propranolol prior to desensitizing him. Neurosyphilis is only effectively treated with penicillin. The patient must be desensitized. Prior for desensitization, it is important to stop propranolol and all beta blockers. This is because epinephrine may have to be used in the event of anaphylaxis when you desensitize the patient. Bolusing with steroids is inappropriate, because anaphylaxis is treated first with epinephrine. 10. A man comes to the emergency department with weakness in his legs that has been getting markedly worse over the last few days. He has weakness and loss of deep tendon reflexes in the legs. He recalls an upper respiratory illness about 2 to 4 weeks prior that resolved. What is the most urgent step? The options are A. Steroids, B. Intravenous immunoglobulins, C. Peak inspiratory pressure, D. Intubation, E. Lumbar puncture. The correct answer is peak inspiratory pressure. This case is Guillain-Barré. Ascending weakness with loss of deep tendon reflexes is characteristic. Peak inspiratory pressure is the correct answer. The peak inspiratory pressure diminishes as the diaphragm is weakened. Peak inspiratory pressure predicts who will have respiratory failure before it happens. This is the most important factor in determining the need for therapy with either intravenous immunoglobulins, IVIG, or plasmapheresis. Combinations of these medications are not effective. Steroids are not effective. Lumbar puncture will show an elevated protein level with no cells. 11. A 60-year-old woman with metastatic breast cancer comes in with back pain. The spine is tender. She has hyperreflexia of the legs. What is the most urgent step? The options are A. X-ray, B. CT, MRI, C. Biopsy, D. Radiation, E. Steroids. Correct answer is steroids. The most urgent step in the management of cord compression is to administer steroids as soon as possible, and to relieve pressure on the cord. Imaging studies are done after steroids are given, if the diagnosis of cord compression is clear, as it is in this case with pain, tenderness, and signs of hyperreflexia in the legs. 12. 28-year-old woman presents at 36 weeks gestation with rupture of membranes. On examination she is found to have 7 cm cervical dilatation. She received all of her prenatal care, and her only complication was a course of antibiotics for asymptomatic bacteriuria. Jeeb's screening was negative. Her first baby was hospitalized for 10 days after delivery for GBS, pneumonia and sepsis. What is the most appropriate management? The options are: A. Administer intrapartum for penicillin. B. Administer intramuscular azithromycin. C. Rescreen for Group B streptococci. D. Schedule caesarean section. E. No intervention is needed. Correct answer is administer intrapartum for penicillin. Intrapartum for penicillin is indicated because the patient's previous birth was complicated with neonatal GBS sepsis. 13. A 43-year-old woman is brought to the emergency department after being burned in a house fire. You estimate first-degree burns to 20% of her body, second-degree burns to 11% of her body, and third-degree burns to 9% of her body. She weighs 60 kilograms and is 160 centimeters tall. What for therapy would you begin immediately? The options are: A. Ringer's lactate at 200 cc per hour for 24 hours. B. Normal saline at 400 cc per hour for 24 hours. C. Normal saline at 150 cc per hour for 8 hours, then 75 cc per hour for the next 16 hours. D. Ringer's lactate at 300 cc per hour for 8 hours, then 150 cc per hour for the next 16 hours. E. Ringer's lactate at 600 cc per hour for 8 hours, then 300 cc per hour for the next 16 hours. Correct answer is Ringer's lactate at 300 cc per hour for 8 hours, then 150 cc per hour for the next 16 hours. Formula: volume needed equals weight in kilogram, kg, multiply by percent of burns, second and third degree, multiply by 4. Volume equals 60, weight, multiply by 20% burns, second and third degree burn, multiply by 4, equals 60 multiply by 20 multiply by 4, equals 4,800 milliliters in 24 hours. Half in first 8 hours, then half in next 16 hours, so its half means 2,400 milliliters in first 8 hours, means 300 milliliters/hour, then 2,400 milliliters in 16 hours, so 150 milliliters/hour in next 16 hours. 14. What is the most accurate test for herpes encephalitis? A. Brain biopsy. B. PCR for CSF. C. MRI brain. D. Viral culture of CSF. E. Zinc prep. F. Serology for herpes, IgG, IgM. Correct answer is PCR for CSF. PCR is more accurate than brain biopsy. Serology for herpes is useless. 95% of the population will be positive. Since blood serology cannot distinguish oral herpes from a routine cold sore, genital herpes or encephalitis, zinc prep test can be done as initial test on a genital ulcerative lesion. Viral culture is most accurate test of genital or skin lesion but not of CSF or brain lesion. 15. 58-year-old alcoholic male was brought to the hospital after a fall from height stairs. His neighbor reported he fell headfirst but denied any loss of consciousness. The patient was disoriented. The neurological exam was significant for left hemiparesis, a left Babinski sign, and a left homonymous hemianopia. CT showed below picture. What is the most likely diagnosis? The options are A. Subarachnoid hemorrhage, B. Subdural hemorrhage, C. Epidural hemorrhage, D. Intraventricular hemorrhage. Correct answer is subdural hemorrhage. Subdural and epidural hematomas, usually associated with more severe trauma than a concussion. Impossible to distinguish without a head CT, even though epidural hematoma is more frequently associated with skull fracture. Subdural and epidural hematoma, treatment is based on size and signs of compression of the brain. Small ones are left alone. Large hematomas are managed with intubation and hyperventilation. Mannitol. Drainage. 16. A 59-year-old man is scheduled for prostatectomy. He has a history of HTN, COPD, and diabetes mellitus. He takes atenolol for blood pressure, tiotropium and albuterol for COPD, and glipizide for diabetes. BP is 145/89 of a millimeter Hg, and bar1C is 7.1. Recent pulmonary tests document FEV1 1.3. Blood CO2 is 47. This patient is most at risk of developing which of the following? The options are A. Intraoperative myocardial infarction, B. Pneumothorax, C. Postoperative pneumonia, D. Hypercapnic failure, E. Respiratory failure. Correct answer is postoperative pneumonia. Severe COPD, FEV1 less than 1.5 liters, increases surgical risk, mainly because patients have an ineffective cough and cannot clear secretions. They are subsequently at risk for postoperative pneumonia. 17. DMARD, disease-modifying anti-rheumatic drugs, is used in rheumatoid arthritis. Which one of the following is drug of choice when methotrexate not works or toxicity occurs? The options are A. Tumor necrosis factor inhibitors, TNF, inhibitors, B. Rituximab, C. Hydroxychloroquine, D. Sulfasalazine. Correct answer is tumor necrosis factor inhibitors, TNF inhibitors. Methotrexate is drug of choice as DMARD as first line in moderate to severe and erosive disease. When MTX is intolerant or not responding, then INF inhibitors is drug of choice. Rituximab is used when MTX and TNF inhibitors don't works. Hydroxychloroquine is in milder cases, usually with methotrexate used. Sulfasalazine is used when INF inhibitors does not works, and NSAIDs and steroid for acute pain first NSAIDs. If no response, then steroid. Neither NSAIDs nor steroid helps to prevent disease progression. Both are for acute pain management and bridging therapy, while DMARD starts acting because they requires long time to prevent disease. 18. Identify the APGAR score of patient having A. Appearance body and extremity pink, P. Pulse rate more 102 per minute, G. Grimace cry on stimulation, A. Activity flexed arms and legs that resist extension, R. Respiratory effort strong lusty cry. The options are A. Score 6, B. Score 7, C. Score 8, D. Score 9, E. Score 10. Correct answer is score 10. 19. A 34-year-old man comes to the clinic with multiple vesicles on his penis. There is enlarged adenopathy in the inguinal area. What is the next step in management? The options are A. Zinc prep, B. Viral culture, C. Valacyclovir, D. Valganciclovir, E. PCR. Correct answer is valacyclovir. When there are clear vesicular lesions present, there is no need to do a specific diagnostic test for herpes. If the question describes multiple vesicles, then treatment with acyclovir, valacyclovir, or famciclovir for 7 to 10 days is the next best step in management. Daily suppressive therapy can be prescribed for recurrent genital herpes. If the roofs come off the vesicles and the lesion becomes an ulcer of unclear etiology, then the best initial diagnostic test is a zinc prep. The most accurate test for herpes is PCR. If there are clear vesicles, this is not necessary, go straight to treatment. Valganciclovir is therapy for cytomegalovirus, CMV. Patients with frequent recurrence should be placed on chronic suppressive therapy. A 47-year male with history of asthma came to emergency room with increasing acute shortness of breath, cough and sputum production for several days. His respiratory rate is 32 per minute, diffuse expiratory wheeze and prolonged expiratory phase. Which of the following would use as the best indicator of severity of his asthma? The options are A. Respiratory rate, B. Pulse rate, C. Pulse oximeter, D. Use of accessory muscle, E. Pulmonary function test. Correct answer is respiratory rate. A normal respiratory rate is 10 to 16 per minute. By itself, a respiratory rate 32 per minute indicates severe shortness of breath. Accessory muscle use is hard to assess and it's subjective. Pulse oximeter will not show hypoxia until patient is nearly at the point of imminent respiratory failure. Oxygen saturation can be maintained more than 90% by hyperventilation of patient. Pulmonary function testing cannot be when patient is acutely short of breath. (21) 25 years female presented with weakness, petechia and fever. CBC showed Hb 5 g/%, Tc 2000/cum and platelet 20,000 per cum. Liver function, renal functions, chest X-ray, ultrasound, abdomen and viral serology is normal. On examination, she has pallor and PTHA. Rest of general examination is normal. Bone marrow showed in the following picture. What's the most likely diagnosis? The options are acute myeloid leukemia, acute lymphoblastic leukemia, chronic myeloid leukemia, aplastic anemia, myelodysplastic syndrome. Correct answer is aplastic anemia. This is classical case of severe aplastic anemia characterized by young female, pancytopenia. Bone marrow is replaced by fatty tissue. Treatment is either bone marrow transplant if HLA match or ATG plus cyclosporin. Success rate for BMT is around 80% and ATG plus cyclosporin is around 70%. 22. A 42-year-old woman has a 2 cm breast cancer tumor removed by lumpectomy, and the breast is irradiated. The cancer is negative for estrogen receptors and positive for progesterone receptors. 3 of 40 nodes removed from the axilla are positive for cancer. What is the next best step in management? The options are A. Adjuvant chemotherapy and radiation of the axilla, B. Tamoxifen for 5 years, C. Anastrozole, aromatase inhibitor, for 5 years, D. Tamoxifen and adjuvant chemotherapy, E. Oophorectomy and chemotherapy. Correct answer is tamoxifen and adjuvant chemotherapy. Tamoxifen is used whenever there are either estrogen receptors or progesterone receptors positive. If both receptors are positive, tamoxifen will be of greater benefit. Adjuvant chemotherapy is used whenever the axillary nodes are positive or the cancer is greater than 1 cm in size. 23. 34 years female, after examining PAP smear, you found ASCUS. What's your next step? ASCUS equals atypical squamous cells of undetermined significance. The options are A. Repeat pap smears, B. Cone biopsy, C. HPV testing, D. Colposcopy. Correct answer is HPV testing. Detection of cervical cancer. Low-grade and high-grade dysplasia on PAP smear is followed up with a colposcopy for a biopsy. ASCUS, atypical squamous cell of undetermined significance, can be sign of early pre-invasive cancer or an infection, or may be simply false positive. If ASCUS is present, perform HPV testing. If HPV found, perform colposcopy. If ASCUS not present, perform HPV testing. If HPV not found, repeat PAP smear at 6 months. Source Master the Board, MTB. 24. A 64-year-old man with a history of hepatitis C presents with abdominal fullness, bloating, and chills. He says he has noted that his abdomen has become bigger and his pants do not fit as well as they used to. Exam shows shifting dullness and a fluid wave. Vital signs show the patient is febrile to 38.3 degrees Celsius, 101.0 degrees Fahrenheit, and tachycardic. Labs show thrombocytopenia, low albumin, and INR of 2.3. What is the best next step in the management of this patient? The options are CT scan of the abdomen, antibiotics, abdominal paracentesis, anti-gas medication, upper endoscopy. Correct answer is abdominal paracentesis. This patient likely has cirrhosis and elevated portal hypertension based on his lab findings, low platelet count, low albumin, history of hepatitis C, and elevated INR markers of impaired hepatic function. The best next step in management is abdominal paracentesis, as this patient likely has spontaneous bacterial peritonitis, i.e., the development of a bacterial infection in the peritoneum causing peritonitis. Symptoms include fevers, chills, abdominal tenderness, and worsening ascites. 25. A school bus is involved in a major collision. 2 children are killed, and 7 others are injured. What is the most important therapy to prevent PTSD? PTSD equals post-traumatic stress disorder. The options are A. Diazepam, B. Fluoxetine, C. Cognitive behavioral therapy, D. Haloperidol, E. Individual psychotherapy. Correct answer is cognitive behavioral therapy. Cognitive behavioral therapy, CBT, seeks to change the way a trauma victim feels and acts by changing the patterns of thinking or behavior, or both, responsible for negative emotions. A 42-year-old woman with a history of hypertension, diabetes, and depression presents to the clinic with dry eyes and dry mouth. Her medications include hydrochlorothiazide, metformin, and amitriptyline. Which of the following is the next step in management? The options are A. Discontinue amitriptyline and change to sertraline. B. Order anti-nuclear antibodies. C. Order SSRO and SSLA. D. Prescribe eye drops. E. Refer to ophthalmologist. Correct answer is discontinue amitriptyline and change to sertraline. Discontinue amitriptyline and switch to another antidepressant medication with little or no anticholinergic effects. Anticholinergic effects are most severe with amitriptyline, but there are almost none with most SSRIs. 27. A patient is brought to the emergency department after a seizure leading to prolonged immobility on a sidewalk. He has dark urine and myalgias. What is the most urgent step in the management of this patient? The options are A. Urinalysis. B. Urine myoglobin level. C. EKG. D. CPK level. E. Creatinine. Correct answer is EKG. EKG is the most urgent step in an acute case of rhabdomyolysis. This case tests your knowledge of how people die with rhabdomyolysis. Severe muscle necrosis leads to hyperkalemia, which leads to arrhythmia. A specific diagnosis with urinalysis or urine myoglobin is not as important as detecting and treating potentially life-threatening conditions, such as hyperkalemia with peak T waves. This condition would be treated with immediate intravenous calcium gluconate, insulin, and glucose. 28. A 42-year-old man with hepatitis C cirrhosis presents with a large umbilical hernia with intermittent pain. On examination he has large amounts of ascites. Surgical intervention is being considered. His bilirubin is 3.0, his prothrombin time is 32 seconds, INR 2.2, and his serum albumin is 1.9. Which of the following is the best next step in management? The options are A. Proceed to emergency surgery. B. Proceed with surgery after first giving vitamin K. C. Proceed with surgery after total parenteral nutrition, TPN. D. Proceed with surgery after albumin infusion. E. Do not perform surgery. Correct answer is do not perform surgery. Do not do surgery in any patients with multiple derangements in hepatic risk factors. Any one of the hepatic risks alone: bilirubin above 2, albumin below 3, prothrombin above 16, and encephalopathy, as suggested by altered mental status, predicts a mortality of over 40%. If 3 of them are present, the risk is 85%. All 4 risks constitute almost 100% risk of mortality. 29. 48-year-old woman comes to the office with chest pain that has been occurring since last several weeks. The pain is not reliably related to exertion. She is comfortable now. The location of pain is retrosternal. She has no hypertension and ECG is normal. What is the most appropriate next step in management? The options are A. CKMB. B. Troponin. C. Echocardiogram. D. Exercise tolerance test, ETT. E. Angiography. F. CT angiography. G. Holter monitor. Correct answer is exercise tolerance test, ETT. Enzymes are done to evaluate acute coronary syndrome. Serial troponin levels are done prior to stress test. Echocardiography is done to know motion wall abnormalities, valvular function and ejection fraction. Exercise tolerance test is to evaluate stable patient with chest pain whose diagnoses are not clear. ETT is not done for patient who has acute coronary syndrome in which patient having currently chest pain and diagnosis is clear. Also do not put patient on treadmill who are having currently the chest pain. 30. A 36-year-old woman presents with pains in both hands for the last few months and stiffness that improves as the day goes on. Multiple joints are swollen on exam. X-rays of the hands show some erosion. What is the single most accurate test? The options are A. Rheumatoid factor, B. Anticyclic citrullinated peptide, anti-CCP, C. Sedimentation rate, D. ANA, E. Joint fluid aspirate. Correct answer is anticyclic citrullinated peptide, anti-CCP. Rheumatoid factor, RF, is present in only 75 to 85% of patients with rheumatoid arthritis, RA. It can also be present in a number of other diseases, hence, the RF is rather non-specific. Anticyclic citrullinated peptide, anti-CCP, is the single most accurate test for RA. It is greater than 95% specific for RA, and it appears earlier in the course of the disease than the RF. There is nothing specific on joint aspiration to determine a diagnosis of RA. Thank you.